And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, Candace, of course, your destination to better health.
And one of the top medical centers in all of the Dallas and Frisco area. And our first doctor who operates right here out of Forest Park Medical Center is orthopedic surgeon Dr. Charles Tolson.
I had probably a 3-year extended period of deteriorating knees. They just got to where I had been able to work out and run. Then the pain got to be such that no, you couldn't run anymore. And I could jog, and then it got to where I couldn't jog. At one point, I finally tweaked one of the knees, tore some more cartilage, and then I was looking like the mummy for about 7 months. It was horrible.
There are 3 compartments in the knee. There's the inner knee, there's the outer knee, and there's the compartment behind the kneecap. When patients have arthritis in 1 or 2 areas of the knee, they're candidates for robotic partial knee replacement. Osteoarthritis of the knee is very common. Often patients have activity-related pain, but later it can progress to having pain at rest or pain that even wakes them up from their sleep.
Went to see Dr. Tolson, a very personable guy. He x-rayed both knees and looked at it, and he said, well, I got bad news and worse news. Bad news is it's really true that you did tear some more cartilage in the knee. The worst news is, even if I repair that, both knees have substantial osteoarthritis, and doing the arthroscopy now is really not going to give you the relief that you're seeking.
Steve was a unique case. He was a 64-year-old gentleman with osteoarthritis of both knees. His arthritis was confined to both the inner aspect of both knees. So he was a great candidate for getting bilateral knee replacement using the robotic technology. Steve is incredible. He is back to his active lifestyle. He has no pain, he has no limp, and his incisions are very small. You could hardly see them.
I'd say it's been a grand experience. I will never again take for granted walking without a limp. You just don't realize all the things that you give up when you're walking around in pain and dragging a leg. It's not any fun, and all that's gone. I can get in and out of cars, I can go up and down stairs, I can do pretty much anything I want to do now.
We're here at Forest Park Medical Center of Dallas, where we are a bariatric center of excellence through the American Society of Metabolic and Bariatric Surgery. What a bariatric center of excellence is it's a designation that a facility has to actually apply for. It covers 10 very vigorous standards that are set forth from the American Society for Metabolic and Bariatric Surgery, and they actually come and interview, they audit charts, they look at outcomes, and they look at 10 very vigorous standards to make sure you meet those standards, from the equipment you have to care for your patients, the personnel that you have involved taking care of the patients. And it's there for patients to be able to select a facility that is above and beyond for their care of bariatric patients.
Part of being a bariatric center of excellence means that we're able to handle any complications that occur with our patients. So we have several physicians that we can consult for whatever needs we may have, whether that be pulmonology, nephrology, neurology, any of those things that we may need. We have those here at our fingertips, and we have that for the ICU and the ER as well.
I oversee all of the medical nutrition therapy both before and after surgery with the bariatric patients. So up to 6 months prior to bariatric surgery, patients can come and see us and work on lifestyle changes. And then we also visit with the patients here in the hospital immediately after surgery, and we offer post-op classes just to kind of keep everybody on track up to a year following the procedure.
I help teach the pre-op and the seminar classes for our bariatric patients or our prospective bariatric patients. We do inpatient teaching after they've had surgery, as well as do the lap band adjustments once they've had surgery. We do upper GIs. We do see them from prospective patients, and post-op wise, we see them throughout the whole course of their procedure, as well as 2 years out, 3 years out, so we continue to follow up with them and see how they're doing and continue their education.
The pre-op procedures that we do in radiology are the upper GIs, and they like to do that to be able to see the intestinal tract before they have surgery, so the doctor knows what they're working with. And then post-op, we bring the patients down and we do upper GI so that the doctor can make sure that all the suture lines look good and there's no leaks and everybody's good to go home.
We do around 3% of the cases nationally for bariatric surgeries. That means that out of all the thousands of bariatric surgeries nationwide, this specific hospital does 3% of them.
We have a great multidisciplinary team, and we do have a great team of our dietitians, our nurses, our surgical staff, our respiratory therapists, physical therapists, radiology techs, everyone. And it takes every one of those members of the team to provide great patient care. And without any one member of the team, we couldn't be as effective as we are.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
The problem of misdiagnosis in terms of where people believe they have pain and where it really originates is extremely common, and almost seems like it's getting to be more so as patients take medical care into their own hands a bit more these days.
The pain would present itself where it would be a dull ache at times, and then it would transform into the shooting pain. It would radiate out from my hip and go across my abdomen and straight down my leg. And whenever I would walk, I would feel like a stabbing pain in my hip and in my upper leg.
The spine is usually the culprit, either the neck or low back. All the signals that we get from different body parts, signals of pain from arthritis or from an injury, have to be transmitted through the spinal cord to get to the brain. And any short circuit along that pathway can be misleading.
When I first saw Dr. Sadie, he took a very conservative approach towards my pain, and he sent me to see an anesthesiologist, and we tried to do some nerve blocking procedures. And that was one of the things I really enjoyed about Dr. Sadie. He wasn't rushing to put me under a knife right away. Eventually, the pain was not going away, and the anesthesiologist said that there was nothing more that they could do for me, and so Dr. Sadie then recommended the T-lift procedure for me.
Once the determination was made as to where his pain was coming from, we came up with the procedure, which is called a decompression and minimally invasive fusion, which is creating more space around the spinal cord for the nerves to exit freely and then stabilize the motion segments.
This procedure was a life-changing procedure, nothing short of that. Before the procedure, I'd wake up with pain and stiffness. 30 days post-procedure, I feel like I can do the activities that I've done when I was back in my 20s and 30s. Both the visit to Dr. Sadie as well as my experience at Forest Park were extremely positive. And I'm happy to say that the outcome was positive because I can sit here today and tell you that I'm 100% pain-free. And that is the ultimate measure of my success.
For more information on Forest Park Medical Center, from staff to surgeons to technology and technique, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Forest Park Medical Center, your destination to better health. Right now, it's time to meet our next doctor who operates right here out of beautiful Forest Park Medical Center. It is Dr. Nicholas Lux.
One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods, and I couldn't even walk sometimes because my pains were just really, really bad. They were sharp, and just getting around, it was just really hard for me.
Now, in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, And she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So Dr. sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are, it depends on the severity of the symptoms. In her case, she was in pain and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, how long I was going to be out of work, and I was only out of work a week. I was there probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lex.
What we found is that there's a new technology for treating reflux that can get people off of their medications. The problem is, because surgery hasn't been used in 20 years or so, we didn't have a good way to evaluate the patients. Those centers were spread out throughout the state, frankly, and we decided that there was a need to have a center put together that could do all the different types of diagnostics that we need to identify reflux patients. Forest Park stepped up to the plate. They bought all the equipment. We got associated with some of the gastroenterologists in town that we hadn't done any work with before, and they've taken the lead to run the center, to do the diagnostics, and to give us the information we need to appropriately treat the patients. We do pH studies. We do pressure studies of the esophagus called manometry. We also do regular endoscopy to look and obtain pathology specimens. And the best test that we have now is called impedance. Impedance is a test in which we're able to actually measure the movement of fluid up and down the esophagus. So where the fluid may not show up in some of the other tests, for sure it's going to show up in this test. The difficulty that we had in the past was we were sending patients one place to get pH, another place to get manometry. We had to send patients down to Houston to get impedance. And so now having all that equipment in one space becomes very convenient for the patient. I think because there's so much information out there on the internet, on the TV, people understand that they have a problem. They have reflux, but they don't understand all the options that are available. When they come in to see me, I'm going to talk about their symptoms, how they relate to reflux, whether it may be due to some other disease process. We're going to talk about the anatomy. We're going to illustrate the anatomy to them in pictures. And then we're going to talk about the different tests that we need to do to confirm that this is actually what we're dealing with. And then we'll talk about surgery if it's indicated. And rather than having to send patients across the state to get that study done, it's something that we could do right here in Forest Park, Dallas.
As always, for more information on beautiful Forest Park Medical Center, the staff, services, technology, check out our website. It's bestdocsnetwork.com and click on the Forest Park Medical Center tab.
And Candace, Forest Park Medical Center, of course, the destination to better health. Right now, it's time to meet our next doctor who operates right here out of beautiful Forest Park Medical Center. It is craniofacial plastic surgeon, Dr. David Jenico.
My life started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Jenico were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on. Then everybody's a winner.
When Mason was about 2 years old is when we first noticed that, we're starting to get strep throat more than just once a year or so. And things really took a turn for the worse more when Zane was born. When Zane turned 6 months old and Mason had just turned 3, about once a month, each child had strep throat in our house. And then of course you can imagine my husband and myself also had strep throat.
So strep throat can come about very quickly or very slowly. For some people, it's just a mild sore throat, and over the next couple of days, it develops into a more severe sore throat, fever, headache, body aches, and all-around fatigue. In other people, it starts very suddenly, and just the sore throat comes on. You get white spots on your tonsils, on the back of your throat. So at that point, what we would do is we take a swab and do a strep test, which is a little swab that goes to the back of the throat, kind of like a Q-tip. And we brush it on the tonsils or on the back of the throat, and then we put it in a little container, do a test, and it takes about 5 minutes. It tells us if the strep is positive or negative.
With Dr. Friedman and his clinic, what they've been able to do is treat us as a family. So we have one child that has strep throat, so we start looking at, okay, who else might have symptoms?
The Biermans were getting strep chronically over and over again. It was mainly in their eldest son, Mason. Finally, we decided after multiple therapies of antibiotics, multiple treatments, we actually tested his parents, found out one of his parents was a carrier, treated the parent, and he stopped getting strep for a while. However, it happened again, and he continued to get strep. So eventually we had to refer him to an ENT and have his tonsils taken out. Now he's done very well since his tonsils have been removed.
Dr. Friedman is near and dear to not only my heart, but my family's. They go above and beyond to make sure that everyone feels comfortable, that everyone is communicated with properly, that everyone comes in and leaves with a great experience.
Emily has a question for Dr. Dan Aldridge. The question, what is arthritis?
Arthritis is a very commonly talked about subject, especially because our population is aging, and as we age, more and more people will get arthritis. Arthritis is, when you break it down to the simplest form, a breakdown of the cartilage. Each of our joints has cartilage on each side of the joint. Cartilage is a very, very smooth and soft surface, and it allows our joints to move very smoothly and very nicely with no pain, with no difficulty, with no stiffness. When arthritis occurs, that cartilage begins to break down. It becomes rough, it becomes stiff, and then eventually it starts to disappear. And you hear the bone-on-bone situation basically means that the cartilage that was there is now gone. That cushion is gone. Now you have hard surfaces rubbing against each other, and this causes significant pain. The two most common types of arthritis are rheumatoid arthritis and osteoarthritis. And the main thing to know about those is osteoarthritis is just related to wear and tear, where rheumatoid arthritis is an actual medical condition that needs to be treated with medicines because it can cause severe joint destruction even at a young age. And there are blood tests to test for rheumatoid arthritis.
Did you know Forest Park Medical Center Dallas campus was the first hospital in Dallas to use the Makoplasty robotic arm for hip replacement and partial knee resurfacing?
Forest Park Medical Center is your destination to better health. And now we're going to check in with our next best doctor. It's ear, nose, and throat specialist, Dr. Allison Weil.
Before I came to see Dr. Weil, I had been suffering for about 2 years of just dull headaches, not feeling good, stuffy. On paper, I am healthy, but I just was tired of not feeling good.
I noticed on exam that Kathy did have a deviated septum. I obtained a CAT scan of her sinuses, which didn't show a considerable amount of sinus disease or inflammation, but it did show that the natural openings to her sinuses were very narrowed. And so I felt that she would benefit, one, from a septoplasty by straightening her septum. In addition, I thought she would be an excellent candidate for the balloon sinuplasty procedure.
We actually did a CT scan to check my sinuses. There was nothing on that she found. She thought maybe I was allergic to some things, so she said, Kathy, let's do a blood test. Let's do that first before we go in and become invasive on you. We did that. She called me and said, Kathy, you're negative. You're not showing allergic to anything. What I suggest for you, there's this procedure out called balloon sinuplasty.
The balloon sinuplasty device is a device that has been around for about 5 years. It's a very minimally invasive way of entering into the sinuses. We take a small, thin, lighted wire and we guide that into the sinus. At that point, we advance the balloon over the wire into the narrow passageway of the sinus, and then we dilate open the balloon, and that opens up the sinus opening. And at that point, we remove the balloon, and the sinus opening actually remains patent in over 92% of the patients.
I sell real estate, so I made sure I didn't have any appointments that week, but as far as talking on the phone and getting up and feeling okay, I was fine.
The balloon sinuplasty device can be done either in office or in the hospital setting. The majority of patients benefit from it in the hospital setting because in addition to opening up their sinuses, like Kathy, she also needed a septoplasty, straightening out her septum. And so doing them in combination while she's asleep under general anesthesia was the best for her.
My life has been totally changed since I've had this surgery. I have never felt better in my life. I have more energy. I feel like I got the Kathy back that I knew. And I just feel great.
I assess patients based on their nutritional needs, if they are at nutritional risk, if I need to do any kind of intervention as far as medical nutrition therapy, which is prescribing certain diets. For example, if a patient has diabetes, then we would order a diabetic, heart-healthy diet so that it would fit into their meal pattern to help control their blood sugars while they're here at the hospital.
Having a culinary team in place definitely gives us an avenue to provide great meals. We feature anything from gourmet pizzas to ready-made salads to order. Everything's prepared fresh right in front of your eyes, and we try to do that in a timely manner.
Forest Park Frisco Cafe Services incorporate patient and family members into our dining experience. So if there's something available down in the cafe that is not on our written menus that a patient can select from, it's still an option that a patient can receive those items from the cafe directly onto a tray up to a patient room.
With Krista, we follow a pretty strict menu that we put out of the back, but then there's also special people with allergies or people that can only have certain things. We're a small enough hospital that they really get a personal care. She touches the patient every day. She brings down the information to us, and we take care of whatever culinary needs they have.
We have people from Frisco City Hall that come and frequent our dining establishment quite often, and they let us know how well we're doing. And I thought it was pretty unique to have people walk down the street, come into this facility. They're not patients, and they don't have any family members here at the hospital, but they just want to try us out because they've heard from other staff members that work with them of how good the food is.
Our menu is not typical hospital fare. It has a lot of, I'd say, Texas twist to it. It's anything from fine dining up in the doctor's lounge to some of the caterings that we do for the doctors. And then down here, we try to do things a little more regional, use some of the local produce, try to make it more of a resort-like setting.
Food and nutrition is a lot about lifestyle changes and lifestyle behaviors, and those things don't happen overnight. So what little coaching that I do get to give patients here in the hospital is mostly through a paper that they can take home with them and do some extra research on it. We try to give contact information for the dietitians as well, so if they have questions post-op, there's always someone available or some kind of way to get the extra information that they may need.
One of the main reasons why I came to see Dr. Angobaldo was because I was not happy with the symmetry of my breast. I do body figure competitions, and when I lean out, you could really see the symmetry of my breast, where my left one was a lot lower than my right one. The implant was very noticeable. And also wearing a bikini two-top, you can see that the left breast was a lot lower than the right one. And so I always either had to pad it or tape it or do something so that it wouldn't be as noticeable. And it was just very bothersome.
So the initial consultation with Claudette, she was unhappy with the asymmetry of her breast. She had previous breast implant surgery by a different surgeon several years ago, and she thought that one implant was lower than the other, which caused less fullness in one breast than the other. She was very self-conscious of that. She competes in fitness competitions, and she wanted also to switch out from a saline to a silicone implant.
As far as the procedure, pre and post, the pre was very comforting. The staff was wonderful. I never felt nervous. Everything from Dr. A to the nurses and anesthesia was great. Post-surgical, probably 2 to 3 days is what I took, and then I was able to get back into my everyday life routine.
Claudette is doing fantastic. She is 5 weeks off from surgery. She's had no complications. She's perfectly symmetrical. She looks fantastic, and she sees, I'm gonna free her up to start competing again and working out within the next week or so.
Now that I've had the surgery and I'm symmetrical, it's definitely a boost of confidence. I don't feel like, I'm being watched or, I'm lopsided. So I can't wait for my next competition. Dr. Angobaldo's bedside manners, for me, in my experience, were wonderful. He was very positive throughout the entire process, starting from the consultation to the pre-surgical and post-surgical.
That'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, the top medical facility in the entire Dallas and Frisco area. And for more information on Forest Park Medical Center, your destination to better health, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
And if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.